introduce myself to my patient. Hello, my name is Lene. I'll be your nursing student today. I'm going to do a physical assessment. Can you state your first name for me?
Alyssa,
Alyssa, can you tell me what year it is?
2013,
And where are we at?
San Antonio.
Okay, so I have assessed her alertness. She's able to talk. She's looking at me. Her eyes are open. She's oriented to person. She could tell me her first name. She's oriented to time. She told me the year. And she's oriented to place. She told me where she is at. I've also assessed her level of consciousness using my Glasgow Coma scale. I've assessed I, the max is 4. She looked at me when I talked to her. Verbal, she spoke to me, the max is 5. And motor, she turned her head and looked at me, the max is 6. So with the Glasgow Coma scale, the max is 15. I'm going to give her 15. I've also assessed her behavior. She was cooperative. Her speech pattern was normal. I'm also, at the time when I was talking to her, I noticed that she's wearing glasses. She is not wearing any hearing aids. Do you wear hearing aids at all? Okay, so she is not wearing hearing aids. Okay, so I am done with that first part of my assessment. Now I'm going to go ahead and I'm going to start at the head. And the first thing I'm going to do is I'm going to look. I'm looking at the head. I'm looking at the size. It is normal cephalic. It is a normal size. I'm looking at the skin. Is there any redness, discoloration? Any open sores, wounds, cuts, scars, any tattoos? I'm looking for symmetry. I'm looking at the placement of her nose and her eyes. All of it is symmetrical. I'm looking, I'm done looking, and now I'm going to take my fake pen light and I'm going to look at her eyes. I'm going to ask you to go ahead and take your glasses off. Okay? I'm looking at her eyes. I'm looking for any redness, any drainage, discoloration, and I'm going to look at her pupils. I'm using the acronym PERRLA, P-E-R-R-L-A. Are the pupils equal? I'm shining light into them. Are they round? Do they react to light? And we're not going to do accommodation, but the A would be for accommodation. I've looked at her eyes. Now that I've looked at her eyes, I'm looking at her mouth. I'm looking for any discoloration, any breaks in her skin, any scars. I'm going to look inside of her mouth. Can you open your mouth up? I'm looking in her mouth for any loose or missing teeth, any dentures, partials. I'm looking for any piercings. I'm looking for a coating on her tongue, any bleeding, ulcers, any dryness, any discoloration. I've looked at her mouth.